Hello, everyone. I'm Kimberly Mars. I'm a clinical fellow, speech language pathologist, and LENG long-term trainee at the UC Davis Mind Institute. And today I am excited to be presenting about communication-related quality of life among individuals with and without neurofibromatosis type 1, NF1, a pilot project. Here is my disclosure. Today, I will review background information regarding communication, swallowing, and hearing within the population of neurofibromatosis type 1, NF1, and I will share briefly about patient-reported outcome measures before I talk about the development and data collection of a pilot survey, which was developed in 2 parts. I will conclude with survey findings and future work. So to begin, neurofibromatosis type 1 or NF1 is one of the most common genetic neurodevelopmental disorders. It's more common than cystic fibrosis and Huntington's disease combined, with a prevalence rate of 1 in 3,000. Individuals with NF1 have a number of physical manifestations, including café au lait macules or COMs, which are these brown colored spots on the skin. There's plexiform neurofibromas, which can be like large head or neck tumors. Here you see one on the arm. There's cutaneous neurofibromas. These are smaller, non-cancerous tumors that are scattered throughout the body. An individual can have 1 or thousands. And then there's optic gliomas, which are tumors of the optic pathway and bone abnormalities. This could be things like tibial bone, which can lead to difficulty with walking or mobility. So just like the physical manifestations, speech, language, and voice resonance and social concerns can really vary from person to person. They are found more frequently compared to the general population. One study by Thompson and colleagues found that 67% of children had a delay in speech and language. These tumors can also cause difficulties with swallowing. A tumor can grow on the 8th cranial nerve, causing difficulty with hearing. There's difficulty with the resonance disorders, and we're not really sure why individuals with NF1 have difficulties with social concerns yet, but primarily, we are using direct assessment methods to assess, diagnose, and treat communication disorders. But what's lacking from these direct assessment methods is that we're not really considering the patient perspective or their experience. So that is currently lacking. So to understand the patient perspective, we can use patient-reported outcome measures or PROMs in addition to the direct assessment. So a PROM is a measurement of any aspect of health status that comes directly from the patient without interpretation of from the healthcare provider or anyone else. And the Food and Drug Administration requires the use of PROMs to be utilized in clinical trials. And individuals with NF1 are often included in clinical trials for drugs, for example, to prevent tumors or to prevent the growth of tumors. And in addition to being required for clinical trials, PROMs can be utilized as a screening tool, measuring change in therapy or aiding in decision-making by the medical team. So when it comes to the field of speech language pathology, PROMs are not new to the field, but they're rarely used. When PROMs are used by speech language pathologists, they are limited in that they may capture the patient perspective from only one area of communication-related quality of life. For example, we have the hearing handicap inventory for the elderly, the HHIE, which may be utilized to learn the self-perceived hearing concerns of patients, but the HHIE does not examine the patient perspective of all areas of communication, such as voice or social skills, nor is it disease specific. So And then from the literature, we found that one survey was conducted almost 12 years ago by cousins and colleagues, finding that 2/3 of individuals with NF1 experience at least one communication-related problem in their sample survey. They found more articulation difficulties and hearing concerns reported. But overall, today, there isn't a patient-reported outcome measure examining communication-related quality of life for individuals with NF1. So that leads me to my research questions, since prompts are beneficial and good practice for not only evidence-based practice, but the treatment as well. And now that you have this background information, I'm asked, do individuals with NF1 self-report more communication, swallowing, and or hearing concerns compared to individuals without NF1? So to do this, as I mentioned in the introduction, this was a two-part study. The first part included the development of the survey for individuals with NF1 and parents of children with NF1. A literature review was conducted, and we collaborated with patient representatives. We received feedback on draft surveys that were provided over a 12-month span, working with the Response Evaluation and Neurofibromatosis and Schwannomatosis International Collaboration Group from the Children's Tumor Foundation. And then the survey provided a few different questions depending on the age selected by the participants. So for example, children were asked about like their current grade, and then adults, for example, were asked about their highest education level completed. To recruit participants for the first part of this project, the link to an online survey was sent out to members of the NF registry. And the second part of the study was for my Lend research project. I used the same survey, and we sent it to individuals with and without NF1. And individuals were recruited via social media this time. All data collected was through Qualtrics, this online platform. And today I'll be sharing the results from the second part of this project, which was data from 16 adults with NF1 to 16 adults without NF1. So we matched the two groups of adults by age. The mean age was 42, almost 43 years of age. The majority were females in both groups. Adults primarily identified as white. We had some slightly more international individuals in the adults with NF1 group. And with regards to education, the two groups were not significantly different from each other. More adults with NF1 reported having hearing loss and having received speech therapy in the past. And then here is one of the sample items. So on the y-axis, we have the answers to each of the items. So from top to bottom, never, almost never, sometimes, often, always. On the x-axis, it was the frequency of responses. The blue bars indicate adults without NF1 group, and then the yellow bars represent adults with NF1. So looking at this specific item presented at the top, I feel frustrated, unhappy, or worried because of my speech. Adults without NF1 reported never, most frequently. Adults with NF1 selected sometimes and often, more often. We look at the next item. I feel frustrated, unhappy, and worried because of how I communicate. There was a tie for never between both groups. However, adults with NF1 most frequently selected sometimes or often. For the item, it is hard for me to hear in one or both of my ears. Adults with NF1 self-reported more concerns compared to adults without NF1 when looking at sometimes, often, and always selected. And then last item, it is hard for me to swallow because I feel like something is stuck in my throat, looking at dysphagia or swallowing difficulties. Adults, again, with NF1, when we look at sometimes, more adults in this group had concerns, although some adults without NF1 did indicate some difficulties. But overall, adults without NF1 had little to no concern. So in summary of my results, overall, adults with NF1 reported more concern, as indicated by marking always, often, or sometimes compared to adults without NF1. This was in line with Cousins and colleagues' 2010 survey, which found that individuals with NF1 reported more concerns with speech, hearing, and communication, but we also found some difficulty with swallowing. Chi-squared test determined statistically significant differences between the expected and observed frequencies as well. With regards to strengths and limitations of the study, a limitation is a small sample size. We want to be cautious with the interpretation. A strength is that both groups were directly comparable, receiving the same items. It was easy to match individual by age. A limitation is that we did not conduct direct assessments. It was just the survey going to each individual, and they reported their self-reported concerns. And the length of the survey could also be a deterrent from individuals completing it. It was 84 items in total. In summary, or future direction, excuse me, we would like to collect more responses. A larger sample size is needed. We have many responses from adults with NF1 from that first part of the study, but we don't have as many from adults without NF1. Also collecting more data from surveys for children and teens and parents of children with and without NF1 would be ideal. And then while I've presented a few items today, there are many more items to analyze and interpret. So future work will be interpreting this data. And then we also want to look and see if participants would respond to the survey the same way at different moments of time with this instrument. And then also complete direct assessments in addition to providing the survey. I would like to acknowledge all the participants in the study, for which I would not be able to do the study without my LEND clinical and research supervisor, Dr. Heather Thompson, as well as my other clinical supervisor, Nancy Castanetti, in the UC Davis LEND program. Here are my references.
Katrine has a question.
Yeah, just quickly, Kimberly, did you plan on repeating this with a younger population as well?
Yeah, we'd love to. We did make a survey with child-friendly language and excluding some more complicated topics like GERD or acid reflux. So yeah, we would be open to including children between the ages of 8 and 12. That was our plan. And we also wanted to collect data from parents with children that and compare those to parents of children without and with an F1. That would be ideal.
Yes, I think that would be really interesting to continue this line of work. Even if, surveys you get about 30% usually of return, but you can send it out pretty widely through the NF groups, as you know from your other work. So.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.